Alright, so I just wanted to do a quick video about trauma kits. Um, this could kind of be whether you have any training whatsoever or if you have none at all. It's kind of a two-way street. Um, you do not necessarily need a lot of training to have a trauma kit. Um, this is my trauma kit right here. This is the kit I use for work as a lifeguard. Just so I have my own gear, and secondly, it's always in my car as kind of a first response kit. Um, I just wanted to talk about a little bit of a theory of mine of what an automotive trauma kit should contain. I always laugh when I hear people say that they have an equipped first aid kit in their car, and it mainly consists of various sizes of band-aids and Tylenol and things like that. And the Tylenol and the OTC medications are a good thing to have. But as far as trauma goes, which is usually what's associated in with automotive things, it's just ill-equipped to say the least. Usually, anything you need a band-aid for, you don't need a band-aid for. Is kind of what I say. If you have a cut that requires a band-aid, you can usually just, suck it for a second, and it'll quit bleeding. You can wrap it in a tissue, and in a couple minutes it'll be done. You don't need a band-aid. Band-aid is, it's not necessary. And to have a first aid kit, stocked with various sizes of band-aids is pretty useless. Just picture yourself coming up on an accident scene and having various sizes of band-aids to treat whatever you find. So I'm just going to talk about a couple things. I'm just going to breeze through. I'm not going to talk about use of anything or anything like that. There are a few items that I don't have in here right now, but they do have them. They're upstairs. I just can't get them right now, and I'll mention them as we get to that kind of section. So on the outside, I've just got my glove bag here. I can't tell if you can see it right there. I think there's 2 pairs of gloves in there, and I also have an additional 2 pairs inside. So you open up the kit here. Notice how it's a bright color. This is an actual trauma kit, but if you have to use another bag, a duffel bag, it's a lot cheaper. Try and get it a bright color because you have to remember that you might not be the one using the kit. And then that's also something to keep in mind when organizing and choreographing where you put your supplies, grouping them in areas of the same type of equipment. So when you open up my kit, first up top you just see a non-sterile 10cc irrigation syringe. This pocket right here contains a large trauma pad, absorbent trauma pad. I think it's a 12 by 8, so about the size of a sheet of computer paper. That would be used for a large abrasion, road rash type of thing. Now you can see why I'm saying that a knee band-aid is inferior to stop the kind of bleeding that's usually associated with a automotive incident. Then there's also just like Purell wipes in there for sanitation purposes, not for wound cleansing, of course. Just sanitizing your hand or any other thing like that. Right here we've got airway stuff. I've got underneath it I've got my blood pressure cuff and just simple stethoscope along with an advanced stethoscope for checking the brachial pulse during the diagnostic portion. Not exactly trauma, but it's in here. I have room. Then for trauma, airway, respiratory emergencies, I've got my bag with the oxygen bag on the back. I also have extra oxygen tubing. The mask here hooks onto the bag. I've got 2 medium-sized cold packs for any kind of heat stroke or anything like that, any injury that could benefit by being iced. Here I've got bleeding control. All are 5x9 ABD pads or surgical pads, trauma pads, anything you want to call them. Highly absorbent, 5x9 inch. When they're opened up, they're all sterile. This is the kind of bleeding control you need in your car. It's the worst feeling ever is being ill-equipped at an accident scene. I've got a large roller bandage here. I think it's a 4 inch by 5 yard, or 4.5 inch by 4 yard. Sorry. Can be unrolled, used to bandage a large wound area, usually on an extremity, or for a large avulsion, it can just be stuffed whole to stop the bleeding. Then you've got your self-adherent wraps, your tapes, your medical tape, your athletic tape. Self-adherent wraps are great. Then I've got a smaller roller bandage down there. And then you got your basic stuff. Another great thing to have is EMT shears. You're gonna have to get articles of clothing off to even see what's going on. And you need a good pair of EMT shears. When you get them, test them. Make sure they can cut pretty thick fabric. You've got simple antiseptics like always use iodine. Never use hydrogen peroxide, anything like that. No alcohol. Always use iodine, whether they're wipes or pop vials, which are sort of my favorite. The pop vial, PVP, for sanitation, which isn't exactly trauma. That's more wound care, but I have it in here. Like I said, I have room. Another good item is just like a 31 gram glucose for any hypoglycemia. Happens quite a bit more often than you would think. Emergency eye wash, I consider that trauma. Saline solution. I've got just your everyday stuff. As far as OTC goes, I've got hydrocortisone burn cream down there. Can't tell if you can see that. Burn cream, swabs, of course, Tylenol, ibuprofen, all that stuff. Aspirin for any cardiac emergencies, chew it, the deal. Forehead thermometers, swabs for checking responsiveness in extremities after a spinal injury, all that stuff. Saline spray for wound irrigation. It's not sanitation, that's just removing dirt, sand, anything that can be in it. Then on this side you've got wound closure. My kit does not have band-aids. Other, gloves, super glue, wound closure strips, steri strips, butterfly closures, non-adherent pads. Always bandage up with a non-adherent pad first, and then put your gauze on top, because when that scab sets and they try and rip that gauze off, it's not going to be pretty. Non-adherent pads first when you're bandaging. When you're trying to control bleeding, it doesn't really matter as much. I've got another syringe in here, number 11 scalpel, benzene swabs, benzene pops, injectables, all in there. Other side, I've got bleeding control, more roller bandages, 2x2s, and 3x3s, and 4x4s. Then I've got hemostatics in here, tourniquet, hemostatic gauze right there for bleeding control, hemostatic powders. Here you've got a 2 gram Celox hemostatic, then you've got like a 1 gram Wound Seals hemostatic for small lacerations, and then in the very back of here I've got my 35 gram trauma Celox hemostatic. Great investment. It's kind of pricey, but you're going to be glad you had it when you stop some serious bleeding, arterial bleeding, anything like that. This will stop it right away. 35 grand for massive trauma. So that's pretty much it. The only thing I don't have that should be in here, it's upstairs, is nasopharyngeal airways and the lubricant for opening an airway. That's pretty much it. I have the pen light here for pupil examination and responsiveness testing. Hemostats in the front I didn't talk about. If you gotta grasp something, they locking hemostats. They're called Kelly, I believe, Kelly hemostats. If you gotta grab a bleeder and pinch it closed, you gotta do what you gotta do. So just hope you guys kind of pick up on that and know what you should be prepared and have what you need to have, because assorted band-aids are never adequate for any car accident.